Hello everyone, I am Dr. Advait Kulkarni. Yes, stroke is absolutely preventable. To understand how to prevent stroke, we first need to understand what are the risk factors of stroke. When it comes to risk factors, the modifiable risk factors of stroke are hypertension, diabetes, increased cholesterol in the blood, obesity, sedentary lifestyle, bad habits like smoking, alcohol, use of drugs. These are very important modifiable risk factors. If one has to prevent stroke, one has to prevent getting these diseases. Or if anybody is having diabetes, hypertension, or obesity, to work on controlling the blood sugars, controlling the hypertension, and reducing weight in a healthy way. Moreover, coming out of addictions is extremely important. Smoking is complete no-no. Even alcohol, WHO has told any amount of alcohol is very harmful for the health. So even once a month or once a week alcohol should be avoided, because one doesn't know when one might get addicted to alcohol because of social and peer pressure. So controlling of the risk factors, coming out of addictions, and the most important thing is also a regular exercise and a good diet. It is important to have a balanced local, traditional, seasonal diet, to get a good night's sleep, to follow sleep hygiene and sleep early by 10 o'clock, not to sleep late because it leads to a lot of hormonal imbalance and it makes you prone to various diseases like hypertension and diabetes. So sleeping early, waking up early, and we waking up fresh in the morning, doing regular exercises, which is a moderate exercise about 30 minutes a day for at least 5 days a week, and following a healthy routine along with stress management habits like meditation and pranayama are absolutely important. And not to mention the last and the least is the practice of mindfulness and gratitude, which helps you to keep your mind calm and relaxed. The long term effect of stroke can be debilitating. That is why we say one has to reach in the golden hour. As soon as possible, you feel that the patient is having a stroke or a symptoms of stroke, one has to reach the stroke equipped hospital as soon as possible, because stroke can lead to long term disability, that is a motor disability, difficulty in walking, difficulty in doing daily activities. Second thing, it can affect the communication because of the speech difficulties, unable to understand spoken words or communicate properly, express oneself properly is the second aspect. The third aspect is impact on the memory and cognitive abilities. Some of the strokes which affect the frontal part of the brain can affect memory, and executive dysfunction can happen where patient is unable to think in a coherent way and do complex tasks. And also multiple strokes can lead to onset of dementia. So it's very important to reach the hospital in golden hour so that we can prevent all these problems which are led and caused by stroke. So what are the treatment options of stroke? I will explain with an example. It was a usual morning and we had a patient who is 35-year-old who came after 8 hours of onset of one-sided weakness. And unfortunately, after 8 hours of onset of treatment, we had only neuro intervention to offer him, because the clot busting injection can be given only within 4.5 hours of the onset of symptoms. So such patients who come late, we cannot offer proper treatments. And the same day a second patient came who is rather older, 70-year-old, but he came within 2 hours of the onset of symptoms, and he had a blockage in one of his small arteries in the brain, that is a branches of middle cerebral artery, and he was an ideal candidate for an IV TPA injection or a clot busting injection. And with the effort of doctors and his willingness to improve and treatment, he improved completely and his weakness improved within a day. So this is the importance of reaching in the golden hour and coming to a stroke equipped hospital. So the first treatment is a clot busting injection, which is a IV TPA or tenecteplase injection, which can be only given within 4.5 hours of the onset of symptoms. The second treatment is the stenting. Like you know, in heart attacks, wherever there is a blockage in one of the arteries of the heart, a doctor does a stenting, where they put a wire through the one of the arteries of the thigh and it goes into the heart and it helps to remove the blockage. In the same way, this kind of treatments, which are thrombectomy treatments or IV thrombectomy, and these treatments can be done within 24 hours of the onset of stroke in subset of patients where there is a major artery occlusion. This is very important to understand because one has to reach as early as possible to a stroke equipped hospital. The third treatment is, of course, rehabilitation, which involves a physical rehabilitation and speech therapy, occupational therapy to help the patient recover faster. Depending on the severity of stroke, one may need a physio and occupational therapy, rehabilitation therapy for weeks to months after stroke. Like patients who have a big stroke may also need to undergo some of the surgical procedures like decompressive hemicraniectomy. Although these are rare, these are also one of the treatments of the stroke. In patients who get strokes because of the venous blockages, which is called cerebral venous sinus thrombosis, again IV injections and IV thrombectomy can be used in subset of patients who don't respond to the medical treatment. The recovery from stroke depends on multiple factors: on how early you reach the hospital, how big is the stroke, and what is the location of the stroke. Patients with a small strokes like lacunar stroke, if it is not in the center of the brain, that is on the basal ganglia and internal capsule, they may recover faster. So every patient's recovery journey is different. What is important is you keep in touch with your neurologist, continue with physiotherapy in home as well as hospital, occupational therapy, and consult a rehabilitation specialist to improve your symptoms as early as possible. Consistency is the key. Some patients who have a large stroke, like a middle cerebral artery infarction or a bleed, may take months or up to 1 or 2 years to improve because it depends on the neuroplasticity of the brain. The part of the brain which is dead because of stroke, the surrounding part of the brain tries to take over that function, and this is called neuroplasticity because brain cannot regenerate itself. So it's very important to consult a physical medicine and rehabilitation specialist and continue and encourage the patient to undergo continued physical exercises, physiotherapy, a good sleep hygiene, and diet and nutritional therapy, and control of risk factors for faster recovery. Thank you.